saudara, apa kabar Anda hari ini? Semoga selalu dalam keadaan yang sehat, semangat, dan juga baik. Saudara, kanker kolorektal atau CRC menjadi salah satu ancaman kesehatan yang semakin banyak dihadapi masyarakat. Di Indonesia, setiap tahun puluhan ribu kasus baru terdeteksi dan sayangnya sebagian besar masih ditemukan pada stadium lanjut. Padahal deteksi dini dapat menyelamatkan nyawa melalui tes fit atau kolonoskopi yang bisa menemukan polip sebelum menjadi kanker. Nah, pengobatan pun semakin berkembang mulai dari bedah minimal invasif, kemoterapi hingga terapi terarah, dan imunoterapi yang mampu memberikan harapan baru. Nah, di Singapura kemajuan dalam program screening dan juga teknologi medis memberikan akses pada perawatan yang lebih personal dan juga mutakhir. Lalu bagaimana deteksi dini dan terapi baru ini bisa menjadi harapan bagi pasien kanker kolorektal? Selama 30 menit ke depan kita akan mengulasnya secara lengkap bersama dengan saya Melisa Gadasari dalam Bincang Kita. Yang sudah hadir di studio Kompas TV bersama dengan saya di sini ada dua orang dokter dari Singapura. Yang pertama, let me welcome our guest, Dr Tan Hon Lyn, the Senior Medical Oncologist from Oncocare Cancer Centre, Singapore. Hello, Dr Tan, how are you?
Good morning. I'm good.
Thank you so much for coming to Kompas TV all the way from Singapore to Jakarta today. Okay.
Thank you for having us.
And also you have Dr Lee Kuok Chung, the Senior Consultant Surgeon, General and Colorectal Surgery from Crest Surgical Practice, Singapore. Hello, Dr. Lee.
Hello.
How are you today?
I'm great. Thank you for having us here today.
Thank you. We will discuss about colorectal cancer.
Yes,
Okay, as I've mentioned before, the CRC is becoming one of the most common health challenges today. So why is early detection of colorectal cancer is so important, and what role does colonoscopy play in preventing cancer progression? For you, Dr. Lee.
So when it comes to picking up colorectal cancer, for early stage of cancer, unfortunately, is asymptomatic, meaning patient do not have any signs or symptoms. Therefore, that's where the role of colonoscopy comes in, where the scope itself can help to detect any cancer, if there's there, or even more importantly, it can help to pick up precancerous lesions such as polyps, where the scope, if you see the polyp, if we remove it, you have taken it out, they got no chance to grow and become cancer. That's how we say colonoscopy can help to prevent cancer by removing all these early small polyps that has easily been removed through a colonoscopy. Even a bit more advanced, slightly bigger polyps, sometimes we still can take it out through a colonoscopy through advanced methods such as we call endoscopic mucosa dissection or EMR or ESD. So with that, we can help to prevent cancer from developing.
Okay, so before they become in cancer, you already take it out, whether it's polyp or maybe simple things, you can do it before it's becoming cancer. Then what are the biggest challenges you face in practice when patients present with advanced stages compared to when cancer is detected earlier?
So in general, for early colorectal cancer, the surgery-wise is very controlled. We will say that with minimal complication because it's an elective case. And usually for early, like stage 1 cancer, surgery will be the only treatment. Patients do not need any other further treatment such as chemotherapy. As compared to advanced cancer, if patient presents late, one, it usually end up as emergency cases. And emergency cases, patient usually a bit more sick. That already makes the case a bit more complicated. Two, during advanced cases, they usually may present with symptoms such as blockage or obstruction. Then they come in with abdomen very distended. In such cases, we need to do open surgery.
Okay.
And open surgery for colon cancer, and if the bowel sometimes not very healthy, we need to, one, remove more segment. Two, there are chances that patient end up with stoma or back. There's a motion coming up here compared to elective cases where the chances of needing those stoma is a lot less.
Okay. So before it becoming cancer, we can treat it nicely. So if the cancer is knowing it at early stage, you can do more better thing to help the patient.
Early cases, usually nowadays we do keyhole surgery, laparoscopic or robotic surgery. For advanced, we still can do if we pick up as elective cases. If they present as emergency, a lot of time is a lot more technically challenging. And sometimes we need to remove more organs. meaning if the cancer have spread beyond the colon, for example, it plastered onto the bladder in front, we may need to remove a segment of bladder, so it becomes a bit more complicated surgery.
I see. Okay, but unfortunately, the data shows that many cases in Indonesia are still diagnosed at an advanced stage. So, what are the most effective strategies to raise public awareness about CRC screening, Dr. Tan?
Yeah, indeed, many people in Indonesia are still diagnosed at a late stage when the cancer is already spread and it's more difficult to treat then. So as Dr. Lee discussed earlier, oftentimes we worry that late detection there's a possibility of more difficult treatment and also a possible lower chance of full recovery. But as we discussed fortunately, colorectal cancer can often be detected early or even prevented through screening.
Okay,
So the preventive measures-wise, public education is key. Through TV programs like this, social media maybe, school events, community events, so that people get to understand symptoms to look out for and understand that screening does save lives. Open conversations like this may help to reduce stigma about talking about difficult things like bowel habits or how the digestion feels, and short reminders from doctors or nurses when patients visit them for different reasons could help encourage screening. And we also need to address fear and misconceptions. So FIT test, which is a stool test that we do for screening, is actually simple and not invasive. Colonoscopy is actually safe and effective. With encouragement and support, perhaps more people will come forward to allow us to detect problems earlier, have easier treatment and better outcomes. And with this, we hope to make a difference in the fight against colorectal cancer.
Okay, so the screening are taking the most important thing if we're talking about colorectal cancer. So Dr. Tan, what are the benefits of molecular testing and also FIT tests in supporting more accurate early detection?
Test or fecal immunochemical test is a test that detects small amount of stool in the blood, which is an early sign of cancer or polyps or more often non-cancerous issues. And basically, if you have no symptoms, the FIT test is a useful test for screening. But if there's blood in the stool or other symptoms, then you need to go for a scope.
Okay.
If the FIT test does show that there's blood in the stool, but we can't see it with the eyes, regardless, the next step is for a colonoscopy to allow doctors like Dr. Lee to look directly at the colon to see what the issue might be. Molecular testing is newer tests trying to identify any gene markers in our blood for even earlier and more accurate detection. But for now, FIT testing remains one of the most practical tools for early detection. It is safe, simple, and effective when done regularly.
Okay, it's good news for all of us, right? Because
Yes.
many people may be feeling scared if you have to do the endoscopies, going to the doctors for screening. But nowadays, the screening is easier, simpler for people, so they can come testing before. So if the polyp can be found, can be removed immediately before it becoming cancer then. Okay, there's a lot more to discuss, but we have to take a break for a while. Kita harus jeda sebentar, pemirsa jangan kemana-mana, kami segera kembali tetap di Bincang Kita. Ada kembali di Bincang Kita, saudara. Saya masih bersama dengan para dokter dari Singapura. Kami sedang membahas mengenai colorectal cancer atau CRC. Okay, we are continue our discussion. I'm going to start with Dr. Lee then. Doctor, how have minimally invasive techniques such as laparoscopy and robotics impacted patients' quality of life after colorectal cancer surgery?
So nowadays, we try to do most of the elective surgery for colorectal cancer through laparoscopy or robotic surgery, mainly because it's for short-term outcome in terms of pain control is a lot better. Because for traditional surgery, it's a long midline cut. Can you imagine? It's like minimum at least 20 to 35 cm long. Compared to a laparoscopic surgery, usually there's just a few small tiny port sites, and the extraction site that varies from around 5 to 15 cm depending on the size of the tumor. So recovery times in terms of pain-wise is a lot better. So that translates to patient stays in hospital shorter. They can ambulate faster. Then they can go home and with their family. So a lot better compared to traditional surgery. And they can, a lot of time, we got patients that after even 1 week, they are back to work, especially doing this office work.
Okay,
Yeah.
thank you to technologies. Yeah, nowadays people can do simpler, no need to do the major open surgery, because sometimes people got scared also to do the big surgery, right?
Yes.
So, what considerations do surgeons take into account when deciding whether a patient requires surgery alone or maybe combined with other therapies, doctor?
So in order to understand whether patient needs just surgery or combination therapy in terms of either chemotherapy or radiotherapy, it basically boils down to the stage of the cancer. So in terms of colorectal cancer, broadly, as for most cancer, we divide into stage 1, 2, 3, and 4. Where stage 1 is earliest, stage 4 is late stage, where it's spread to the rest of the body. So typically for colon cancer, in general speaking, stage 1 and 2, we just do surgery will be sufficient. In terms of the rest, if stage 3, meaning stage 3 means that the tumor have gone to the lymphatic drainage, lymph nodes around. Then this group of patient needs chemotherapy.
Okay.
But in order to decide firmly which stage you're in, unfortunately, a lot of time depending on the final biopsy or the specimen that we send after the surgery, because that one can only help us detect whether the patient's final specimen show the tumor has spread to the lymph node. Then you decide whether the patient needs any more additional treatment. And also the a bit more in-depth is the final histology in terms of the tumor type. And the differentiation whether this is very aggressive tumor versus a bit more moderate to lower end of the stage that help us decide. So in general, early stage treatment, just surgery. Later stage, we need a combination.
Okay, so that's why it's more important for us to know the cancer in early stage, so we can do the surgery alone, no need to do the therapy again. So do the screening is the best method to do. Yeah. Okay, I'm going to Dr. Tan. Doctor, what is the role of chemotherapy, radiotherapy, and combination therapy in patients with intermediate to advanced colorectal cancer?
So chemotherapy uses drugs to kill cancer cells or to spread them from, or to stop them from spreading, and it may be given before or after surgery. After surgery, the aim is to remove or eliminate remaining cancer cells to reduce the risk of cancer recurrence. And we sometimes give chemotherapy before operation to shrink cancers to make the surgery easier and more effective. Radiation therapy is particularly important for rectal cancer, where focused high-energy rays are used to target and destroy cancer cells in the rectum and nearby tissues. It can be given alone or combined with chemotherapy, and we call that chemoradiation, to improve the effectiveness. When given before surgery, it can shrink the tumor and lower the chance of local recurrence. And a newer approach called total neoadjuvant therapy, or TNT, means that we deliver the full course of chemotherapy and radiotherapy before surgery, and this can shrink tumors more effectively and increase the chance of complete response, meaning that at surgery, we actually don't see cancer cells left behind. And in certain cases, this method even allows patients to avoid surgery if the tumor disappears completely, and we can monitor the patient and the area of cancer safely. In metastatic or stage 4 colorectal cancer, when the disease has already spread to other organs, the treatment is focused on controlling the cancer, improving symptoms, maintaining quality of life, and prolonging lifespan. And colorectal cancer treatment can involve multiple different stages, from surgery and chemotherapy and long-term follow-up. So having a coordinated team allows our patients to receive the right treatment at every step. So usually for the doctors, we don't just work with surgeons and oncologists and radiation oncologists. We also need to involve nurses, dietitians, palliative care specialists, and many other colleagues for optimal care at every stage.
Okay, thanks again to the technologies. Yeah, new things can be found not only for radiotherapy, not only for chemotherapy, surgery, but also the targeted therapy and immunotherapy. So the targeted therapy and immunotherapy are said to bring new hope. What are the latest developments you can share with the public?
So targeted therapy and immunotherapy, they are changing how we treat colorectal cancer. Targeted therapy really is meant to help the doctors choose the most effective treatment with the least side effects for our patients. And this is by understanding the tumor-specific changes. And basically the aim is really for better tumor control with the least side effects, better quality of life, and possibly better survival outcomes, meaning patients live longer. Immunotherapy works by helping the body's own immune system recognize and attack cancer cells. And it's especially effective in certain types of cancers. And in some rectal cancers with these special features like dMMR or MSI high, your doctors will discuss this with you. Immunotherapy can sometimes even lead to the tumor completely disappearing, such that they do not need to go for surgery or radiation therapy. While that may be a small group, but it is significant and helpful for those patients who can enter a long period of cancer control or remission. For patients who don't yet fit into current treatment protocols, understanding the gene markers or what targeted therapy might be helpful sometimes opens up opportunities for treatment on clinical trials, which can also be helpful for the individual patient and also overall the medical field. So in the end, understanding cancer at the molecular or genetic level really helps the doctors provide more precise and effective treatment to improve the overall outcome and quality of life.
Okay, so not only helping the doctors to help the patients, but the patients self can live longer, can have a more quality life, like you've said before. So it's good news for us to hear. Yeah. Okay, so there's more to discuss, but again we have to take a short break. We're gonna be right back to discuss with you. Jadi Anda juga jangan kemana-mana. Kami akan segera kembali tetap di Bincang Kita. Terima kasih saudara, Anda masih bersama dengan kami di Bincang Kita. Kami masih membahas mengenai kanker kolorektal atau colorectal cancer CRC. Saat ini masih ada bersama dengan saya, para dokter dari Singapura. Ada Dr Tan Hon Lyn, Senior Medical Oncologist dari Oncocare Cancer Centre Singapore. Dan ada juga Dr Lee Kuok Chung, Senior Consultant Surgeon General and Colorectal Surgery dari Crest Surgical Practice Singapore. Baik, kita ngobrol lagi. We'll continue with Dr. Lee then. You've mentioned before about the minimum invasive surgery. Then also there is organ preserving strategies. It's now increasingly being developed. Is it true that some patients can now avoid major surgery?
Yes, it's true. In surgery, we're always evolving. We will try to do same or better surgery with less invasive, meaning less pain for patient. We try to preserve more organs. In colorectal, especially in terms of like early cancer, we can try to avoid surgery.
Okay.
We got organ specimen here. We can see. For example, earlier I discussed about polyps.
Can you hold
If
a little
the
bit higher?
polyp size is big, usually last time traditionally they said that cannot be removed from colonoscopy. We'll need to do surgery to remove that segment of the colon. Nowadays, we see that the polyp, if just invading the first layer or what we call very early stage, we can try to do from the scope to take it out.
Okay.
We call it ESD or EMR. To remove it, it takes a bit longer, but at least if we can remove it successfully, patients do not need a surgery to remove that segment of the bowel.
Okay.
So that is one of the advancements the last couple of years. We try to do that more, so patients do not need a major surgery to have their whole colon preserved. Right, that's one. Then in terms of organ preserving, particularly for cases of rectal cancer, rectal cancer usually is involved you can see a specimen here, the bottom part near the anus. What's important organ here is
higher, doctor?
organ important here is your muscle that control our anus.
Okay.
So if the cancer here involving this area, a lot of time we need to remove the whole area. So patient end up with a permanent stoma bag.
Okay.
So that prevents a lot of patients from going for surgery because they do not want the anus to be taken out.
Yeah.
So this day and age, we will try to do our best to preserve this. That's where one is where the oncologist is very helpful, give us medication, chemo, radiotherapy to shrink the cancer to a size that we can remove it with good margin without sacrificing the anus, the muscle. Two, during surgery, nowadays we use robot, especially robotic surgery. We can do very precise dissection. We can go in along the plane until the area of tumor, go below, slightly lower, remove it without sacrificing the whole muscle. Sometimes we need to remove a bit of segment, but we still can preserve, patients still have a good functional outcome. They still can control their anus. They have without a permanent bag. They may have a temporary bag for a while, but we can close it eventually, then still got normal function. So in that terms, is we can preserve the normal function of our anus, which is believed very important for a lot of patients.
Yeah, because sometimes maybe people don't want to do the screening because they're scared. If they're sick, they're going to do a lot of surgeries. Their quality of life is going to be lost, maybe like that. But if we can preserve the organs and can do life normally, of course, it is good news for everybody, right? So the patients from Indonesia also interesting. I believe to go to the Singapore. What would you advise if a patient wants to seek the colon cancer surgery in Singapore? What do you advise?
So in general, when a patient calls up to ask for appointment for to see us or for surgery, first thing first, we tell them if whatever report you have, you pass it to us.
Okay.
In colon cancer surgery, especially if the patient has a colonoscopy done, that's how they detected the tumor. We want that report.
Okay.
If you can see the photo, even better, or video. Biopsy, the report. And the lastly is a scan, either a CT scan, MRI, or PET scan. So all these things help us to go through it and see that what is the best type of surgery for patient, or patient may need other treatment first. Like for example, Dr. Tan may need to give chemo before the surgery. At least we can explain to patient, anticipate how long they need to be in Singapore. So typically for example, the patient only needs surgery. So usually I advise them, they come to Singapore to stay in the hospital for the surgery. Stay usually on average for colon cancer, they stay around 3 days to 5 days on average in hospitals. Okay. Yeah. So but after that, usually we still want to monitor them for a couple of days before they come back to Indonesia. So they can stay at hotel for another week, where we will review them in the clinic, and we go through the result. Usually by then, got the final results out. We go through, is this stage 1? Is stage 1 very good? We don't need any more treatment. Unfortunately, if later stage, like for example, stage 3 cancer, that's where we need to refer to oncologist like Dr. Tan to have further treatment in order to achieve a full cure for patient.
So it depends on what stage you are not right now, but you just bring all of the tests, just prepare for like 3 to 5 days. It's so short for
on
the
average,
surgery.
usually, yes. But usually we advise them to stay in Singapore for at least 2 weeks for all these things to be done.
It's still so short, for doing surgery like this. Okay, it's a good news for the audience from Indonesia. So, Dr. Tan, how does personalized treatment through molecular testing can help in selecting the best therapy for each patient then?
So like Dr. Lee mentioned, we want to know everything about the tumor. So besides the reports he discussed earlier, sometimes we send the tumor sample for extra testing to understand the tumor better, because every person's cancer is unique. Even 2 people with the same type of cancer can have different genetic changes that makes their disease happen. So when we send the tumor for extra testing, it helps us look at what the underlying gene patterns are, and sometimes we can adjust or add treatment according to what we find. And basically, there are targeted drugs that we can use in certain situations to help allow the cancer to be treated better with less side effects. And at the end of the day, our aim really is to try to have the best outcomes with the least side effects to allow patients to live with treatment comfortably as much as possible.
Okay, so the molecular test is so helpful, yeah, for the
Yes.
screening and also for the treatment for the patients in the end. Okay, for looking ahead, what is your greatest hope for colorectal cancer management in Indonesia for maybe over the next 10 years, Dr. Tan?
So the aim really is that colorectal cancer, while it sounds really scary, it is something that can be treated, and actually even preventable. So we hope that there will be overall greater public awareness. All the doctors as well as the multidisciplinary care team, meaning the different doctors, different allied and support teams, we can help to achieve widespread early detection. And even if the disease is at a later stage, there's very good and effective treatment and even personalized therapy based on molecular testing to allow more and more patients to get timely, effective, and life-saving treatment such that overall outcomes are better.
Okay, thank you so much, Doctor, for our discussions today. I hope our discussions can do what we want to do in the beginning, yeah, giving the awareness to the public. I hope after watching our show today, they can do the regular testing, because knowing that if you do the testing earlier, you can save more lives, you can have a better quality of life, and you can go to Singapore easily right now. You can meet Dr. Tan and Dr. Lee also. Thank you so much for your time.
Thank you.
Good luck for everything you do in the future. Ya, saudara, melalui perbincangan hari ini kita belajar bahwa kanker kolorektal bukan hanya tantangan besar bagi dunia kesehatan, tapi juga bisa dilawan dengan deteksi dini dan terapi modern yang terus berkembang. Bagi Anda yang mungkin tertarik mengenai informasi yang kami bicarakan hari ini, Anda bisa mengunjungi website atau akun media sosial yang tertera di layar kaca Anda untuk bisa mengetahui lebih lanjut mengenai pengobatan kanker kolorektal yang tersedia di Singapura. Semoga informasi ini membuka mata kita semua tentang pentingnya pencegahan dan penanganan yang lebih baik di masa depan. Saya Melisa Gandasari, pamit undur diri, kita jumpa lagi di lain kesempatan. Sampai jumpa.